Good evening, Pioneers. This is Bill Rood coming to you from Thomas Hall at Marietta College. I want to thank you for joining us for today's virtual town hall. With only 4 weeks left in the semester, actually 23 days till finals, 3 weeks of class and 1 week of finals, and the increase in positive COVID-19 cases, I wanted to speak directly with our students, their families, faculty, staff, and any alumni who have joined us today. Back in the summer, when we decided that we would return for in-person learning, we came together as a campus to develop protocols and recommendations that would help us mitigate the spread of COVID-19. Of course, we also knew there was a chance that some of our students and employees could test positive during the semester. Overall, I can't tell you enough how the students and our employees have done an amazing job of minimizing exposure this semester. However, as I'm sure most of you know, over the past 2 weeks we have seen a small spike in cases. As of today, we have 32 active cases and approximately 135 students and employees in quarantine. Many of these cases will either be completed or quarantines will end in the next several days. And we know our quarantine protocols are working. We have also worked with the Ohio National Guard and conducted 2 rounds of community sampling testing. A total of 272 tests were administered, and we had only 8 positive results, a positivity rate of 2.9%. Since we made it through 8 weeks with almost no cases, these numbers are somewhat surprising to some of you. However, understand that we anticipated that we might face a situation just like this, and our Center for Health and Wellness and Student Life teams have done an absolutely outstanding job of working with students who have been affected. I also want to take a moment to thank our amazing faculty and staff for the job they have been doing in managing the in-person experience while also showing the flexibility to include students virtually who are impacted by COVID-19. On Friday, I shared with all of you that we have instituted a 2-week physical distancing period. It's a pause, if you will, to help slow the spread of COVID-19 on campus. We believe when everyone follows these protocols that we will recover very, very soon. We have also put all varsity athletic activities on hold until the number of positive cases decreases. We're also still asking that our students do not travel over these final 4 weeks. Please don't go home. Understand, Mom and Dad, that they're not coming home right now. Please don't visit friends at other colleges, and also please do not have guests from other colleges or elsewhere on campus, most especially if you're in quarantine or in isolation. On Wednesday, November 4th, the Ohio National Guard will be back on campus to conduct another round of community sampling testing in the Dyson Bottle Recreation Center. The testing will occur between noon and 2 p.m. We are also going to ask them and see if they can return again on Wednesday, November 18th, so our students can be tested before they return to their hometowns. We will let you know once more as we know more about the final round of testing. Let me inject my day today, Sunday. I had the pleasure with my wife of health walking about a dozen young students. I'm here to tell you, with hopefully you get smiles on your face, the most popular drink is sweet tea from McDonald's, and unfortunately the most popular food is French fries from the same place. Students that Judy and I walked with were upbeat, they were excited, they were coming out of their quarantines on a variety of levels during the next 4 or 5 days. They have had a great experience, from one student who said she was most excited that she was quarantined at a local hotel and she had a king-size bed. Another student told me that they were watching the reruns of The Fresh Prince from Bel-Air. That made my heart feel good. They're back in my generation. So students are doing well, they're upbeat, they're moving forward, we're feeding them, we're giving them health walks. We just put a series of movies on the website, so know that even if they are in quarantine, that they're being well taken care of. Tonight, like previous town hall meetings, we're here to give you updates and answer your questions. If you have a question, please include it in the comments on Facebook or YouTube, and we will do our best to get it before we wrap up this evening. If not, we will make sure we answer your question before the end of the night. As always, joining me today are Provost and Dean of the Faculty, Janet Bland, to answer your academic questions, Vice President for Student Life, Richard Danford, to answer student life, quarantine, and other student life questions, Vice President for Communication and Brand Management, Tom Perry, who you will hear asking a variety of questions, and of course our Director of Intercollegiate Athletics, Larry Heiser, who will be able to answer any questions about athletics or our student athletes. I've asked each of them to join me today to help answer your questions about everything. Nothing is off the table. So anything from how the next 4 weeks will look to what we expect the next spring semester to look like. Before we get to your questions, let me reiterate something I said in last Friday's email. We are not planning and we do not expect any need to transition to 100% virtual learning. We're well below the number of cases that would necessitate that type of move, and we are confident that the number of positive cases and quarantines will decrease over the next 5 to 7 days. Okay, moving on. Before I ask Vice President Richard Danford to the podium to say a few words, I want to remind all of you, if you have questions, be sure to add them to the comments section, and we will again do our best to respond. With that, I ask Vice President for Student Life and Diversity, Dr. Richard Danford, to share some updates on how our students, your students, are doing in these final weeks. Richard?
Thank you, Bill. Good evening, everyone. As Bill says, our students are doing very well in spite of the challenges they're facing, and I want to give them some applause and some affirmation for being cooperative, being transparent, and being collaborative with us as we've worked to investigate close contacts with positive cases. We've had students come forward and say, I don't believe that I was identified as a close direct contact of someone, but here's the context. Can you tell me if I was a close direct contact or not? And we're able to answer their questions, move them to quarantine if they need to move to quarantine, reassure them if they don't need to move to quarantine, and provide them guidance on how to make sure that they continue to be safe and healthy, and encourage them to report immediately any symptoms of concern that they might start to experience. So that is helping us keep the spread of this virus to the lowest degree possible among our student body. So thanks to all of you who have been doing that good work. And as Bill says, we're not expecting to have to move to a totally virtual experience for our students this semester, and in large part that is because in those environments where there's close and structured supervision and control of student activities, we are not seeing spread from one student to another, or from students to employees, or from employees to students. So even though we have had to quarantine some students in the classroom from classroom contacts, we have not seen any spread of the infection from those sorts of circumstances thus far. Just in the way of numbers, we currently have a total of 49 cases that we've seen this semester on campus. Total resolved cases through today is 17, which means we have a total of 32 active cases currently on campus. That includes students and employees. The total number of resolved cases today is 5, and the total number of new active cases today is 4. We have currently 135 individuals in quarantine, that's students and employees. 68 students are currently quarantined either somewhere on campus or at a local hotel. Later this week, as Bill indicated, we will be releasing, we expect to release a total of 2 resolved cases and 58 quarantine cases by this time next week. The things that we're doing to support the needs of students who are quarantining or isolated because they're a positive case is providing transportation, if needed, to testing sites, providing transportation to hotels for those students who have to go to a hotel and don't have transportation of their own, meal deliveries from Gilman Dining Hall, 3 meals a day, Monday through Friday, and brunch and dinner on Saturday and Sunday, attending to their laundry needs if they have laundry that needs to be taken out while they're in quarantine or isolation, taking that out, having it laundered and returning it to them in their quarantine or isolation location, meal and package deliveries. This is extremely important because we've encountered multiple students who have absentee ballots, and we want them to be able to vote. So, we've been taking care of those needs and making sure that those students feel that their vote is safe in our hands. We also make arrangements for providing them with trash bags and assuring that there's trash removal on a daily basis from their locations, making sure they have the toilet paper and paper towels and sanitizing materials that they need in those locations, providing telemedicine and telecounseling services through our Center for Health and Wellness, and staff nurses at the Center for Health and Wellness offering wellness walks on as much a daily basis as their schedules have permitted. And for student athletes who are in quarantine at this point in time, staff from the athletics department and from the athletic training program are working with them to do some structured, supervised outdoor activity that will allow them to get some exercise on a regular basis without running the risk of them spreading any potential illness to other people. So those are the updates that I have for you this evening. I'm sure you'll have lots of questions, but before we get to that, I'd like to welcome our Director of Athletics, Larry Heiser, to the stage.
Thanks, Dr. Danford. So I wanted to maybe answer a couple of questions that I anticipated, but I wanted to first off commend our coaches and our athletes for really having 9 great weeks. The caseload was really low, and the progress that our teams made, I talked to the coaches sort of individually before we made any decisions about how their teams were doing, and all of them reported that we were making great progress physically on the field, so people were getting a lot of reps and it was working out well. As of Monday, we started to see the spread, and that was on the 19th. So I put out a notice to our coaches that here's the things we're going to be looking at to decide how we move forward. And one of the things would have been a big jump in the positive rate at the ONG testing, or the Ohio National Guard. And if we saw that, that might mean that we'd have to take some action. The other thing was going to be continuation of new cases developing outside of quarantine, people who did not get put into close contact and we're developing symptoms outside of quarantine. And so by Friday morning, Dr. Danford and I, along with our Restart Task Force, with the athletic training staff, we meet with Ann Goon from the local Board of Health. We had our answer, and we knew that it was time to pause. So one of the questions that I thought everybody might be asking is, well, my team's not sick, why are we quarantined? And so really, why the whole department, and why no sports implements? Why can't we just play catch with a ball, or throw a lacrosse ball, or do that? And really, our mission is to eliminate athletics from being a factor in the next couple of weeks. If there's going to be any spread, it's not going to be from athletic activity. So we have to take everybody out to do that. And implements just naturally draw a crowd. I think it's a healthy way that student athletes interact with each other. It's completely natural. I'm not trying to, vilify anyone for wanting to use a ball or a bat or whatever. But for these next 2 weeks, we're really asking our athletes to revert to being healthy, well-adjusted citizens, use the DBRC in the way that it's been designed for COVID, which is limited access and frequent cleaning. And if we can do that for 2 weeks, maintain our health, maintain our mental balance, we'll come out of this ready to go on November 9th, I think, and get a week of practice in before final exams. But if we don't, then we won't practice until final exams are over. So I'm asking everybody to do that in that fashion. Lastly, as we do look forward, the athletic directors in the conference are really trying to get their head around testing and really working hard at finding a way to have an active spring semester, and we're confident that we're going to push towards that goal up in November and December. Plans that we will be able to implement after the new year. So hang with us, and is Dr. Bland going to take the mic? No. We're going to turn it over to Tom for questions that all of us might be able to answer.
Sure.
Thanks, Tom.
Sure, not a problem. Actually, Dr. Bland is going to be up next, though, so she's going to be the first one to take some questions. We'll give her a chance to get up there, and we'll get started here. Yeah. So I'll kind of try to fold a few of the questions that we received online already into one question for you. So it's sort of, the first part of it is looking at the next 2 weeks, is there a reason, or are we thinking about going virtual, which I think we've kind of answered, but just to kind of give maybe a reiteration of why we chose to still do in person, but also the question of if my child or me as a student would rather go virtual for the rest of the semester, what are their options for that as well?
Sure. First of all, we are not going all virtual. I want you to think about what we're responding to, which is the context where we've had some positive cases. And so I can tell you the place where we have not had any positive case that's traced to two students being together is sitting in class together. Getting out of the residence halls, students are masked, walking across campus, going to their classes actually gets them out of their residence hall rooms, which I think would be pretty cheery, for my opinion. And we're not seeing a safety concern because people are being diligent. And I want to echo what others have said. Our students are working so hard. Our faculty and staff are working so hard to do this. And it really is working in those classrooms. So although we have put cameras in every room, I've talked a lot about all of the technology we have the ability, if someone is quarantined or isolated, to continue their education. We understand the ability to have some contact with your faculty member, to have contact with other students really is crucial intellectually, academically, and frankly emotionally. So we don't see a moment right now where we have any cases that have been passed in class. So class is actually a pretty darn safe place to be. And Tom, if there was a second part?
The second part is just students who are interested in going virtual now anyways.
There are some students who may be looking at this and feeling some anxiety, who are thinking maybe I should go completely virtual, sort of more as a response, not necessarily a specific medical question. If you have a specific medical concern, we would be addressing that through Kristen English, through the Academic Resource Center in terms of an accommodation. If it is more a matter of saying, this is causing me a lot of stress, maybe there's more anxiety, maybe I'm just thinking, what am I going to do? Please contact my office. Either I or Suzanne Walker can talk to you about your particular situation. We would like to hear from the students, so we can talk one-on-one with the student.
So one more question for you, and then we'll go to Dr. Danford. Not so much related to everything that's going on, but there is, I think, a student or maybe a parent who's wanting to know how to register for the online courses over the break. So just thought I'd go ahead and get it while you're up there.
Oh, you mean the other ones
Yes.
we're offering? Yeah, please do keep up with your education. You can register through our usual portal. The way you do, if you have any questions, please contact Tina Hickman, who is our registrar. I will make one announcement in terms of student teachers, because we usually have questions about that. Our student teachers are continuing to be in our local schools. I had a conversation with Dr. Tanya DePicella on Friday, I believe, about the fact of regardless of what the standards are in any given classroom that they would be in doing their student teaching, our students are masked. So they are expected to take our standards out there regardless of whether or not they were asked to do that. The same goes for our music therapy students. We have several of them doing practicums. They will continue our practices and our safety protocols even when they are working off campus. We are continuing this because at this point we feel our students are safe, and we understand that these professional experiences are baked in to their licensure and education requirements. So we would like to keep that going as long as we can, so long as it is safe. So that is going to continue, and I believe we are asking our education students to participate in the testing. It is free, obviously, so we are not incurring a cost, but we want to make sure we have as much information as possible for our education students that they're staying safe as they go into the public schools. And I believe Dr. Danford is going to be next.
Yeah, and as he's walking up, I'll go ahead and ask the question. We've had a few folks ask a very similar question where we've put in this sort of 2-week social distancing, physical distancing sort of protocol in place. They're just wanting to know if people violate this, are there repercussions to this? How is your office handling this with students and whatnot?
Dr. Root is in the background there making some hand gestures that have caused me to laugh. Yes, there will be repercussions. Those will be reported as violations of the Student Code of Conduct for not complying with directives from college officials, and they will be asked to go through a student conduct process.
Sorry, you answered that quicker than I anticipated, so if you'll give me 1 second, I'll get to the other
Sure.
question. Let's see here. While I'm looking them up, I do appreciate there are a lot of comments, so I'm trying to keep up and get to everybody's. For you as well, they're curious about some of the positive cases that have come through the random testing. Were these, the question I think is being asked, were they showing symptoms when they showed up? And if not, or whatever the answer is, are they showing symptoms now that they've been positive? I think just trying to get a feel for how this is working.
The National Guard testing, Tom? Yeah. So the positive cases that have come through the National Guard testing, that testing is intended for asymptomatic individuals. We ask people who are experiencing symptoms to go through the Center for Health and Wellness, who now have rapid antigen tests available for initial testing, and if those results are positive, those students are referred on for the laboratory-based PCR test if they need confirmation. But for individuals who are asymptomatic who went through the National Guard testing, some of them have developed symptoms after they got a positive test result, some have not. It's a small number, so only a total of 6 students in that group. So I would say it's probably about 60-40 in terms of those who experienced symptoms versus those who did not after they received that positive result.
So as Dr. Bland pointed out, that classes are a safe spot. Someone wants to know if students will still be quarantined if they sit near a student that tests positive.
If the contact in the classroom, based on the interviewing that happens, indicates that there is a need for that student to be quarantined, then yes, they will be quarantined. But the investigation into the context where that close contact may have occurred is extremely thorough. People are talking with students, they're talking with the faculty, they're going into spaces with measuring apps on their telephones to, and taking into consideration whether the person who tested positive was symptomatic at the time that contact occurred or not. We're strongly encouraging students to not go to class if they're feeling symptomatic, and to reach out to the Center for Health and Wellness or another medical provider. But we have had instances of students going to class not feeling particularly well, or beginning to not feel well in class. And so in those cases, we are taking a very close look at that and quarantining those who we feel need to be quarantined, but not overdoing it and quarantining individuals who may not need to be.
Good. Still another quarantine type question. The question is, why aren't we having a 2-week campus-wide quarantine? We don't know who is positive and not displaying symptoms, and so many of us are incredibly anxious. It wouldn't be a fun solution, but I do not feel like fun really matters at this point. I don't know if there's...
So I'm not sure what...
Well, it's more just wanting to know why we're not just doing a 2-week quarantine of everybody on campus.
Who have we excluded from the quarantine?
I think
we're not calling it a quarantine because a quarantine
yes.
is
I think that's the
official
question is, instead of like we would be treating the people who are being quarantined,
Yeah.
why aren't we just doing it across campus? I mean,
From my perspective, it is not necessary because the spaces that we're asking students to go into, we're asking them to go into places where they're carefully monitored, where they're being careful themselves, and if they're not being careful, then they're being asked to be careful or to leave. So it's not necessary, because a quarantine would mean that every single student would not be allowed to leave their room. So all learning would be online. We would have to deliver meals to every student in their room, all those types of things. And that is not where we want to go, because we still want to have as much of an in-person experience this semester as we can. And so that's why we have not implemented that kind of strategy at this point, because our numbers don't warrant it. Our numbers of positive cases are in very clearly defined pockets. We know and see clear connections between our positive cases, and they fit with certain groups in different areas of the campus community. And we're confident that those are the students who are being impacted, and those are the ones who we need to have separated from the rest of the community for the time being, until we can stem the spread of the illness.
This is a little bit for you and Dr. Bland. You guys can figure out who wants to answer what part. So I'm kind of putting two questions together here, and there's still wanting some more clarification of what the repercussions are or would be, depending on if people are breaking rules. And there also seems to be some agreement by a few that even when they're in classes, there's students who aren't wearing their mask and no one's telling them to put the mask on. So I'm trying to balance this because of what I've heard both of you talk about to try to answer that. So I don't know, Dr.
So
Bland.
I'll take the first question about consequences for violation. It's going to depend on the nature of the violation, obviously. And we have had to make some unfortunate decisions just in the recent week about students who have refused to comply with the orders that we have issued. And when the violation is sufficiently egregious, that is the kind of action we will take. Generally speaking, the kinds of violations that I think people may be concerned about are not sufficiently egregious to warrant the kind of action we took earlier this week with a few students, but we are prepared to take that kind of action if needed, and I'll let Provost Bland take the other part of that question.
If you are sitting in a class and someone doesn't have a mask on, I want you to text me. My cell phone number is 303-619-1634. What's that number again before we get to the Ginsu knives? 303-619-1634. Tell me who you are, what room you're in, and tell me someone doesn't have a mask on. There's probably more rumors maybe about this than actual happenstance, but call me, literally, or call my office. Call Angie Stevens, my coordinator. Call Bill Rude. You can call Paula Lewis, who is his coordinator. Reach out when it is happening, because I know there is concern about this. I don't want people sitting in classes doing this at all. And again, when I message the campus, I have a refrain about extend grace and show courage. It is awkward for peers sometimes to look at each other and say, I need you to put on a mask. It is not awkward for grandma to do that. So I am happy to tell people to put on their masks, and I challenge you pioneers to be willing to say to someone, I need you to put on your mask before I have to text the provost, 303-619-1634.
We're going to have to stay up there, Dr. Bland. There was the one question that I think you started to answer, but there's still wanted some clarification. It was more from the perspective of education students and the testing being voluntary, and I think some of the education students have been told they have to, and they're wanting to know if it's voluntary, do they have to take it? So just trying to clear that piece up for them.
We are offering the opportunity, so that's the voluntary part, to anyone on our campus for this series of free tests, because we think the more information we have, the better we can respond to this situation. And it allows a certain amount of peace of mind. So that is certainly open to everyone on campus, but we are our education department is specifically asking, and I am backing them up, that our education students are able to participate in this, so we have a test. I have had several tests. It is not a natural human state to have a very long stick up your nose, but it is brief and it is survivable. So we are asking our education students to do that. It also helps us because we are visible in this relatively small community, and although cases have had a small uptick in Washington County here in Southeast Ohio, we also are aware of community perception. We have very strong partnerships with local school districts, and we want to make sure that we are proactive, that when our students are going into their classrooms to learn to be teachers, that we are doing everything we can, both to ensure the safety of our students, but also the safety of those pre-K through 12 teachers and students. So yes, we are asking students to do that. It is free, and again, it is survivable.
President Rude to step back up just for a few more general questions that I think would be a good time for him to answer these. You kind of gave the story earlier about seeing some of the kids in quarantine, and someone asked, are the kids in quarantine being taken care of? Are they getting checked on? That kind of stuff. I'd just like you to follow up a little bit with
absolutely. The dozen students that my wife and I had the pleasure of walking with My wife walked a couple students around 5th Street. I walked with students out on the golf course. I walked with one student who brought her basketball with her so she could dribble the basketball. They loved getting outside. And Richard alluded to that we will work hard through Richard's office and Larry's office to make sure that students get the kind of exercise that they need. A couple requests for weights, and I know Dash McNeil in our Office of Athletics has been delivering some weight equipment to some of the quarantine students so that they can work out while they're in quarantine. Spirits were good. Judy and I also delivered food. We ran into a dad who was delivering food to, dropping off food, not delivering, but dropping off food to his daughter in good spirits. And so, yes, they are doing well. They know the number of days it is as they come out of quarantine. Every student that Judy and I walked with today had no symptoms whatsoever and had no symptoms during the time that they were in quarantine. So we will continue to do that over the next 5 to 7 days. And as students are in quarantine, as Richard alluded, we're going to take very, very good care of them in terms of their access. The biggest thing for me to any students listening, any parents listening, make sure you reach out. If a meal doesn't come, if you need a book, if you need something, whatever it is, you have plenty of access to us. Now, of course, you have the Provost cell phone number. But we are serious that if you need something, no matter how small you think it might be to you, we will do it. We will get it to you. If I have to get in my car personally and deliver it to you, if I have to walk across campus and put it by your door personally, we'll make sure you have it.
This has to do with the Ohio National Guard testing. So 2 pieces of this question.
Okay.
One being the question about it being volunteer and maybe being much more of a sampling of campus, more as we've talked about. The second part of this question is any chance that we could move the date, because with the 12 to 2 every Wednesday, the students who have the conflict always have the conflict. So
Right. Good question. We believe we have a good stratified sample in the 272 cases we have of faculty, staff, students from a variety of locations on campus. So that's very, very good. We also have a community day this coming Wednesday and the 11th of November over in our PA parking lot, where if you wish, students, faculty, and staff are also eligible to do that. And yes, we are well aware of the 12 to 2 challenge. So this last event last week, the National Guard was here about 11 o'clock, and they were able to start serving people at about 11:30, 11:35, and they stayed late with one station open until about 2:10 or 2:15. That will continue to occur. If in fact you are concerned about timing, again, reach out to us and let us know when you are available so we can make sure you get to the front of the line.
Looking ahead to the spring semester,
Right.
There are 2 questions. One being, will students be required to test before they return to campus? Is there anything that we're talking about or any protocols you're thinking about?
Yeah, it's a great question, Tom. Absolutely. This is, as many of you probably know, the last 6 months have been fluid on a day-to-day basis. The rules have changed, the observations have changed, the requirements have changed. Right now, we know that we will need to do significant testing next semester. We know there'll be requirements for student athletes to be tested. So we do plan between, again, 3 months is a long time between now and the beginning of spring semester. So yes, we do plan on securing on-site antigen testing that we will be able to do on, again, a community sampling basis. We will also continue to have our symptomatic testing. So again, as people have symptoms, we will make sure that they go through the same protocols that we're going through this semester. And we hope to have additional information out to you, not only during the rest of the semester, but in the break, where we can give you an up-to-date idea of what kinds of requirements and what kinds of conveniences we might have for you or you might need to have as you come back spring semester. Rest assured, we will over-communicate to you. You will know what the requirements are, what we're thinking about doing, and where we're going. Planning is absolutely the in place for next semester. And we believe that part of the protocols next semester may very likely be some more regular testing of students, faculty, and staff during the semester.
One more question,
Sure.
then we'll turn it over to Larry Heiser. It's still about next semester. There was a question about with the stress and everything else that's going on, why are we only having the 1 day off in the spring semester and not having a spring break and just the 1 day off?
That's a great question, Tom. We obviously have debated that. We are not by ourselves. I have not seen a college or university that's put out a spring schedule yet that has a spring break. The obvious answer is we don't want to put students, thousands of students, from thousands of universities all over the United States, potentially in and out of this country, such that we have the potential of large groups and things of that nature. We will have the 1 day at spring break, but we will know that we will also have a series of activities and events during spring semester so that you will get a chance to have some rewards for good behavior on campus. You will have a chance to take some breaks. Our faculty and staff very much want to work with you to make sure we understand no spring break, like no fall break, is a challenge. But again, right now, the information we have and the best information we have tells us that we are planning not to have a spring break so that we can move forward, defeat this virus, and get to a successful culmination of spring semester by the 1st of May.
All right, I am going to stop you before you go off, just so you can, and one more, just to reiterate when we start, what those dates are for the spring semester.
Spring semester begins Monday, 18 January. That is Martin Luther King Day. Normally, we have not had class on that day. We will be having class on that day, and we'll be honoring Dr. Martin Luther King Jr. With his day of service, potentially on the day before that, and during the first 2 weeks of the semester with a variety of activities. I believe the day off that's currently scheduled in the spring is March 3rd. And then the end of the semester, the last day of finals will be April 30th, with graduation on May the 1st. Again, we promised our class of 2020 to have an in-person commencement. Know that we're still working on that one and hope to announce some opportunities for you as we get into the spring semester. And we're very hopeful that we will have a full in-person commencement Saturday, May 1st, 2021. Larry.
Larry, just a couple sports-related questions that have been on there, and I'll just kind of give them all to you and let you sort of answer them. One, it really is just your thoughts on, do you see a spring season really happening? If so, will there be fans allowed to be there? Just some thoughts on how a spring season might come around.
I do see a spring happening. We just have to sort of get over the hurdle of the Division I bubble. So we don't have that. So it's going to take a tremendous amount of discipline for us to do that, because we're going to have to try and create an OAC bubble. Right now, most of what we're going to be doing, probably all of what we're going to be doing in the spring, is going to be OAC competition. The spring sports, because they're outside and low contact, might have non-league competition still there. We haven't made a determination on spring sports yet, but rapid antigen testing frequently is really going to be the key to all this. So I'm looking forward to having a spring season, but we haven't gotten all the way out of there yet. Tom, was there another part to that question? Sorry.
Fans.
Oh, the fans. So one thing as far as basketball is concerned is we did hook up with a company called Hometown Ticketing to help us do online ticket selection. And we just have a myriad of ways to get into our facility for basketball, from foster parents to students to paid customers. So right now, I think that we probably would be looking at students and parents. If I had to tell you today, on October 25th, what basketball might look like, that could change. But our facility is big enough to spread everybody out and enjoy the game. And we can still make some noise in there, even if we're not at capacity. So right now, basketball would be an online ticketing process that we would get that link out and you would pick it on and show it to us when you got to the door. Dr. Bland is next.
Dr. Bland, as you walk up, there seems to be a variety of questions that sort of hit on this topic, so I thought I'd just bring them into one, and that is, with the spring semester, with the way things have gone this semester, wanting to know if there's a chance for more sort of maybe virtual days, no homework days? Is there something that we're talking about or thinking about that might be able to help with some of the things that are going on?
We are very aware that this is frankly the weirdest college experience anybody's had since World War II. And so we are absolutely open to discussions. No homework ever, lovely as that sounds, not going to happen. But we really are going to be looking for opportunities to engage you, to keep your spirits up, and to have some fun. So stay tuned. We are also trying to think about when we're doing exams, etc. So we're working with our faculty. That said, the classes you take in the spring are obviously going to have all the same content as if you had taken them any other time. So there's going to be absolutely no academic shortchanging, no change in rigor, but we are empathetic to the desire for a little whimsy maybe and a little fun.
I think I could answer this question, but I'm going to let you go ahead and do it as well. We shortened this semester a little bit by compacting everything. There seems to be a belief on here that the spring semester is longer. I guess just wanted to have you answer. I think it's still the same amount of days and time.
We did essentially to try to make this a little more of a sprint this semester and a little less of a marathon. We said we're going to take 1 week of contact out of the schedule. That's why we're a little shorter this fall. And we are asking the faculty to engage that face-to-face activity in a different way. So you might have an evening schedule of student presentations online, for instance. So that time that would have happened in sort of the week we removed, we're building in other places, and your faculty member would have been working with you. In the spring, we are certainly hoping that we'll be through a good part of the cold and flu season, that we will hopefully be closer to not only a vaccine, but perhaps some distribution. And we have time. We were really up against Thanksgiving. Again, if you remember, that priority to not have students go home and then come back. We wanted people to be able to have Thanksgiving, but again, please don't invite everybody. But we wanted them to be done. And so one of the reasons we compressed in the fall was to make sure Thanksgiving was the end. And so we sort of had to count back from there. We have much more flexibility in the spring. We had the ability to say we have the same number of instructional weeks as we usually would. The semester itself in the spring is on the calendar taking up one less week. So if you think about that, that's spring break. We basically took it out and shoved the other blocks together. So it is back to what you would think of as normal class time.
Just one more for you. I know we've already covered this, but it's come up a couple times since then. It's still the wanting to know if a student wants to go virtual the rest of this semester or even next semester. Just answer what our policy is and how we're approaching this.
If you have a medical issue that makes you more at risk, so that's sort of a separate situation, we would like you to be in contact with us, with Kristen English, through the Academic Resource Center, and then we're talking about an accommodation. For instance, someone might say, I'm concerned I have severe asthma. If it is more a concern, we would actually like to talk to you when it's not necessarily medically based. So again, you can contact me, you can contact Dr. Suzanne Walker, so reach out to the Office of Academic Affairs, so we can talk about what the situation is. We are concerned because we don't think the answer here for general student well-being is that you sit for the next 3 weeks just in your room. That's pretty isolating. And particularly, these classes again are socially distanced. That is, as far as we can tell from our statistics, that's the safest place people are on campus, is in class. And so we're really wanting people to look at the big picture and think about what going to class does give you. And I am very concerned about the issue of the isolation of staying in there. So you can reach out to us and talk to us about it, but we'd really like you to have as much college experience as we can give you. And Dr. Root's next.
President Root, as you step back up, I have 2 questions for you, but we'll do the first one right now.
Sure.
There is a question about campus tours, campus visitors coming and stuff like that. we are still doing those, but can you talk about some of the precautions we have in place and why we think it can be successful?
Scott Schaefer and his team have really gone back to a lot of what we were doing this summer as we started out of some of the lockdown with the quarantine, where we're still doing virtual. We are very limiting in what we do in terms of campus visitation. We have postponed a couple of events again for the next 2 weeks because we're trying to do social distancing with any kind of groups. We still do some individual visiting, but Scott has a very solid protocol of limiting access where students come, limiting who they might bring with them, limiting them to one family at a time. So again, we're looking forward to the fall of 2021 and are trying to balance the ability to virtually have people visit with the same opportunity to in-person visit. But know that for the next 2 weeks, with the current rules that we put into place, any kinds of visitations you will notice will be much more limited. As we evaluate the cases after 2 weeks, we will continue to look forward in what the new visitation rules are going to be.
Next one is from a parent, just curious, obviously not getting to visit their child on campus this semester, wanting to know what the odds are of maybe next semester having a space on campus or a place where we might set aside that they might be able to come and visit.
Sure, the Disney World option where you have a place where you can go and eat and take your mask off. It's a great idea. We will certainly consider that. Know that parents can figure out ways to mail things, deliver things, box things, Amazon things to their student. Please utilize whatever form of communication they like, whether it's texting, the phone, or email. I realize email is a generational issue. But no, that's a great idea, that question, in terms of the possibility of a location. And again, please understand, next semester is 3 months away. We are hopeful that the treatments, the vaccines, the updates, the cases will all have changed for the better by next semester, so that we can offer additional opportunities for families to potentially engage with their sons or daughters on campus.
This is a quick, easy one so we can get it in there, and it's asking about where we would normally have our December graduation celebration. Can you talk about what we're doing this for the fall semester?
Right. Well, hopefully, we have a small number, so we'd like to try to get it in person, but we are still going to base that decision on the next 2 weeks. Potentially, if we need to Zoom that, as we've done the last 2 graduations for the PA program and for our spring semester, we will do that. Know that there will be a ceremony for the fall graduates at Marietta College, and know that we will have more information out to you as the rest of the semester progresses. Small group, but know we're still using the data from the next 2 weeks to ultimately make that decision.
And along those lines, as we keep evaluating things, the question has come up multiple times about how many positive cases does it take for us to have to make a bigger change, maybe going online completely?
Well,
and also before that, what are those numbers? Does it have to be current positive cases, or is it all the cases together?
No, it's a great question. It's not all the cases, because all the cases have run over a period of time. All the quarantines have run over a period of time. We concentrate on positive cases. We concentrate on where those positive cases are, as Richard talked about. Generally, a lot of folks look at a 5% level or more of positive cases that would really cause us to go virtually. For our student population, employee population, that's 1,500 folks. 5% would be 75 or more currently active cases. One of the reasons we're doing what we're doing right now with 30 cases is we're trying to stem that tide, knowing, as Richard said, several students will be coming out of quarantine next week. Several students will be completing their isolation for a positive case. And again, we continue to test so that we want to make sure we measure both the symptomatic and asymptomatic portions of our population. But we believe we're very, very low right now, and that's why we're taking decisive action now, so that it doesn't ever have to get to a number where we would go 100% virtual.
I will ask you a question. This could be really for anyone, but there is the health and wellness sort of approach, the mental health and all things going on. And again, it might be Dr. Danford, it might be you, but just how in your from your side of things or your opinion has that gone? I think there's some concern that maybe it hasn't always been as available as need be. So
Okay, first off, if it's not available again, I think the word's out now that Bill and Judy Root have done health and wellness walks today, and Bill and Judy Root are willing to do health and wellness walks for the rest of the week. Coaches will, other staff members will. Please reach out anytime that you need to talk about something, discuss something, are concerned, have an issue. Reach out to your coach, reach out to your professor, reach out to me, reach out to Janet, reach out to Dr. Danford, and make sure that we know. Sometimes it's a phone call. Sometimes it's running into you on the mall. I know that our walk today, it was an absolutely fabulous discussion from football games yesterday, baseball games yesterday, books that students have read, TV shows that they're watching, movies that they're watching, how late they're staying up. And amazingly, which I'm so proud of our students, getting ahead of their assignments for the rest of the semester. Many of you moms and dads would be very proud of your kids, knowing that they're actually a couple, 3 days ahead of where they're supposed to be, partly because of the issues that are going on. But they do have access, especially in quarantine, to all forms of telemedicine, both physical telemedicine and mental health telemedicine. Make sure they contact the Center for Health and Wellness if they have any needs whatsoever.
And the other part of that question that I didn't get to, it was somewhat the lack of having time off, not having the breaks that they're used to having. I know we've done our best to explain that throughout, that was one of the trade-offs, but I don't know if you want to add anything else.
Yeah, no, I'll just add, and I understand, we said it early on, we're all in this together. Faculty, staff, employees at the institution, along with students, have not had any time off. We're trying to get through it. It's a national emergency. It's a global pandemic. We are working hard to get through it. We don't want to put students or faculty or staff in a position where we take a long enough break so that they have too many opportunities to spread out throughout the United States and beyond, such that they would then either have to quarantine when they came back or bring the disease, symptomatic or asymptomatic, back with them. Is it tough? Absolutely. But this is the time, this generation in 2020 needs to stand up to the challenge. Be patient. I believe a vaccine is on its way. I believe the treatments are getting better. I believe that our students are capable of getting through this. The thing that I always advise all my vice presidents and all our staff and faculty, find some time for yourself during each week, where you read a favorite book, watch a favorite movie, watch a favorite rerun, play a game, color in a coloring book, talk to your mom, talk to your grandma, talk to your granddad, talk to Uncle Joey, whoever it might be, so that you can kind of separate your mind from some of the challenges that are going on, reposition yourself, and get back here. That's why we're making exercise still available. That's why we're making the health and wellness walk still available. So we're really trying hard. Do we get it? Do we understand? Yes. As we get more guidance from CDC and the Ohio Department of Health, Washington County Health Department, we will adjust accordingly to make sure your semester is as rigorous and enjoyable as possible.
All right, we got two final questions and we wrap up for the evening.
Okay.
Back to your favorite topic. You got to walk students around today. There's people who want to know how they get on that list, or when do they find out what time they can go on one of these wellness walks.
Okay, I'm going to look at Richard, but primarily the way they're getting on the list is through Kim Gandy and Beth Casto in our Center for Health and Wellness. Those are our two, and by the way, just so moms and dads know, we have two fabulous RNs in our Center for Health and Wellness. Beth Casto, who's a public health nurse, who used to be the #2 person at the Washington Health Department, absolutely fabulous. And Kim Gandy, who's an emergency room nurse, who has 4 kids, and 2 of them are here. 2 of her children are going to school here with us, and her husband happens to be an accounting alum from Marietta College. Those are the 2 easiest places. But again, students know my email. Students know Paula Lewis's email in my office. She coordinated a number of those. But reach out primarily to Student Life, Richard Danford, Beth Casto, Kim Gandy. But most importantly, reach out to somebody so that we know you'd like to go on a walk. And like today, if you don't mind walking in the rain, Judy and Bill Rood will find a time. Judy teaches on Tuesday and Thursday, but she's good Monday, Wednesdays, and Fridays, and I will find time to make available my time to as many students as I can.
Well, before I give you the last question, I want to thank everybody for taking the time to tune in this evening and post a lot of great questions. As we said, it's impossible to get to every one of them here live, but we will follow up on a lot of these as we can. So final question, President Rood, is, and this one came in ahead of time, it's, I don't know how often you've heard this, but despite all the challenges and uncertainties, my daughter's really enjoyed being back on campus and taking classes in person. Can you talk about some of the things you, the faculty and staff, have learned during this semester that you think will help make the spring semester more successful?
Wow, the $48 million question. I think we learned that you are going to a college with the most outstanding faculty, staff, and students that you would find in any college and university in the United States and probably in the world. And I know that sounds like I'm bragging on everybody. I am. I couldn't be prouder to be the president of this university, this college, Marietta College, today, during one of the biggest challenges we faced in our lifetime. But we've learned that we have outstanding faculty, staff, students. We've learned that we can be flexible. We've learned that we respond to questions. Students, don't hold questions back. Please ask. You will be surprised the adjustments that we can make, faculty can make, and other folks are willing to make. So make sure you engage faculty and faculty in the classroom. We've also learned that we were able to push through. We're able to put protocols in place. Obviously, I have to talk about the Marietta College cocktail, wearing masks, washing your hands, physically distancing, and checking for symptoms and temperature. I will compliment Richard Danford's shop. We set a protocol, we followed the protocol. We are actually quite amazed that we see some students going into quarantine before they even show symptoms or before they even test positive, and therefore know that when that happens, all too often there is no contact tracing because they haven't exposed anybody else because we've already placed them in a quarantine situation. We've learned to pay attention. We've learned to pay attention to 17 bosses. The CDC, the Ohio Department of Health, the Washington County Department of Health, the state of Ohio, the governor of Ohio, the President of the United States and his task force. So know that we are listening and digesting that information and really trying to pay attention. Larry Heiser would probably tell you of the numerous phone calls, conversations we've had in the Ohio Athletic Conference with coaches, with athletic directors, with presidents, about what are our variabilities, what are issues of the OAC, and what are issues that we can coordinate on campus ourselves. We know we're different. We know that in Washington County, Ohio, and Marietta College, we're different than other parts of the state of Ohio and other parts of the country. We're very, very lucky with the health care system we have down here, with Marietta Memorial Hospital with 350 physicians, and with Camden Clark Hospital across the river in Parkersburg with 250 physicians, a part of the West Virginia medical system. So know that we have fabulous consultations with our healthcare providers and our partners in terms of what we can do, what we should do, where we're going, and how we're doing it. On the other hand, I will also tell you we don't have all the answers. If anybody in this particular situation would tell you they know exactly what January is going to look like, exactly what, sometimes I wonder what tomorrow is going to look like. Know that we have the confidence, we have the diligence, that we're going forward, we're moving on this. We put student, faculty, and staff safety and health number one. And we'll make sure that we do that for the rest of this semester. We'll make sure we communicate with you over the break, and we'll make sure that we continue to communicate through email and town halls during the next semester so that we can complete a very successful fall 2020 and engage an even more successful spring semester of 2021. So thanks for all your questioning, Tom. I appreciate it. Thank you, the audience out there, faculty, staff, students, parents, alumni, for joining us on this evening on a busy Sunday when you have a lot of other things going on, and for absolutely all of your great questions. Thank you to all the parents out there who are entrusting us with the safety and well-being of your children. I commit to you 100%, we will keep them safe. We have done so many things well this semester, and I'm confident we're going to end this semester on a high note. In August, I directed everybody who stepped on our beautiful campus to rise to the challenge and make this the best semester ever. I'm proud to say you have not disappointed me. Now, I'm asking you to keep rising up and finish off these final 4 weeks strong, and then everyone can enjoy an absolutely deserved and extended winter break. While you're on break, however, we will not forget about you. As I said before, I promise we will be emailing you updates and holding additional town hall meetings before everyone returns to start the spring semester on January 18th. Mark your calendars. For sure, our 2 next town halls will be December the 9th and January the 13th, both at 6 p.m. December 9th and January 13th, both at 6 p.m. Again, if you have any questions at all, no matter how small or how large you think it is, please let us know. Our mission is to continue to keep all of our students, our faculty, our staff, our community, and our alumni safe and healthy during this challenging time. Thank you so very much, and go Pioneers.